Hi, my name is Sharon Parlia. I will be your instructor for the course entitled Fundamentals of Health Informatics. I've broken this course up into 8 separate modules. Each one will be a different topic. Today's topic is on electronic medical records. I will give you an overview of what an electronic medical record is and how it affects us in a hospital setting. So I hope you enjoy the course, and let us begin. Let me begin by giving you an overview of what this module will encompass. We're going to talk about the following items. First, we'll talk about what's an electronic medical record, what is an electronic medical record. Then I'd like to talk about the benefits of an EMR, how it helps providers, how it helps patients. We will also be discussing the features of an EMR, how also it helps to improve diagnostics and outcomes, and also improves care coordination. Next, I'd like to also speak about the efficiencies and cost savings of using an EMR. And then lastly, we'll speak about the EMR incentives, specifically meaningful use and the Affordable Care Act. So what is an EMR or an EHR? Are they synonymous? Are they the same thing? We hear these terms all over the place and all the time, especially in a hospital. So let's look into it a little deeper now. An electronic medical record is a digital version of a paper chart. It contains all of the patient's medical history and clinical data in one place, kind of like a one-stop shopping. An EHR, or an electronic health record, is designed to share information from all providers involved in a patient's care. So whether you're the admitting physician or the referring physician or the primary physician or a specialist, you all have access to the same information. Data is shared across visits, and it's contained in one place. Again, one record, one place, everyone can access it. An EHR moves with a patient to other healthcare facilities as well. It goes to other hospitals, other providers, nursing homes, as I mentioned, specialists, for instance, an orthopedist. Anyone can share the information in this record. Now let's talk about some of the benefits of an EHR. So some of the benefits include the ability to track data over time, the ability to identify patients who are due for screening and preventative visits, such as a colonoscopy or a pap screening. It also monitors how patients measure up to certain parameters, such as vaccines and blood pressure readings. Mostly, though, it improves the overall quality of care. This is very important, and that's the main goal of the EMR. Another item it does is it gives you the ability to share data. When all team members can communicate effectively and efficiently, everyone benefits, including the patients, their families, and the providers. Now let's look into how does an EMR benefit the physicians. A main goal is for efficiency and also quick access to patients' records. Now a physician can access a record from an inpatient and from remote locations. They could be on the golf course and they can access the patient's record. This helps to provide more coordinated and efficient care. It also enhances decision support. Clinical alerts and reminders pop up, helping doctors make clinical decisions. It improves analysis and communication of patient information. It also helps support for diagnostic and therapeutic decisions. Most EMRs have built-in safeguards against potential adverse events, such as a medication-to-medication alert or an allergy to medication alerts. These are inherent to most EMRs on the system today. Continuing with the benefits of an EMR is the ability to see legible, complete documentation. There's no more handwriting analysis that has to be done when you're trying to read a chart. It's all there on the computer. It facilitates accurate coding and billing as well. This way the coders can get information and they're not guessing as to what the doctor documented on. Next, interfaces with labs, registries, and other EMRs. You can now, send information through interfaces directly to government agencies and registries, like an immunization registry. You can interface with different labs in the area. The orders go out to the labs and the results come back into the EMR. It also safer and more reliable prescribing. A lot of the e-prescribing that takes place now, it's automatic. It's great. And there's also performance improvement tools, real-time quality reporting, very important. So how does an EHR benefit patients? Well, it reduces the need to fill out the same forms over and over again at each visit. How many times do you go to the physician's office and you're asked to fill out the form one more time? Now it's right there, it's on the EMR. Often, whether you sign it and it's scanned back into the record, or you electronically sign a form, either way, it's in the EMR and accessible each time the patient comes into the office or into the hospital. Also, it's a reliable point of care information and reminders notifying providers of important health interventions and maintenance. It's very important. I also want to talk about patient portals, where each EMR, as part of meaningful use, has something called a patient portal, where the patient can have an online interaction with the provider, whether it's to discuss just an email chat back and forth, or they can often schedule an appointment this way. They can see most commonly, they can see their results, whether it's lab results or imaging results. And it's a very useful tool. Another benefit to the patient is electronic referrals. It allows for easier access to follow-up care with specialists. Now they can schedule that appointment with the specialist. The referral is done automatically. And as I mentioned before, the convenience of e-prescribing. Now the patient doesn't have to take the paper prescription to the pharmacy, wait for the prescription to be filled. It's just done behind the scenes. When you e-prescribe, the prescription goes right to the pharmacy. All you have to do is show up and pick it up. Now I just want to touch briefly on some of the features of an EMR. First, the patient demographics. We have all the patient information in one place, easily accessible, and doesn't have to be repeated each time they come in. They just have to be verified. Patient scheduling. Again, one-stop shopping. You have everything there. You can schedule the patient. You can then document clinical documentation. As we mentioned, it's more legible, it's easier, it's in the record, it's easy to find, easy to read, easy to print out. Orders and results. Now you can order right in the EMR. Behind the scenes, there's interfaces. When you place an order, the order goes to either a lab or to a radiologist, or it prints out, or it's a referral, but it all happens behind the scenes. Likewise, if it's a lab, the results, usually it's a two-way interface, so the results come back into the EMR, and they're there, and it's finalized. E-prescribing, we already discussed all the benefits of that, the ease, the quickness, the neatness. Billing, another item, but very prevalent and very important. Clinical decisions, when everything's in one place, the clinical decisions are there. A lot of the EMRs also have the knowledge and the wherewithal to make clinical decisions based on the diagnosis and the history of the patient. Patient portal, we also discussed that, the excellent communication tool for patients and providers, and the ability for reporting. Now I want to talk about improved diagnostics and outcomes. EMRs can aid in diagnosis of diseases and reduce medical errors. It's very important. EMRs also can improve patient safety and support better patient outcomes. EMRs keep a record of patients' medications and allergies, also looks for conflicts. When a new medication is prescribed, it automatically checks for problems and conflicts, such as a medication to medication problem or a medication to allergy. Sometimes a patient's allergic to certain medications. This is done by the EMR, alerts pop up, and it prevents a lot of medical errors. Continuing on with the improved diagnostics and outcomes, we'll talk about the information gathered by a primary care physician, or a PCP, and recorded in an EMR can ultimately help an emergency room doctor if a patient arrives and is unconscious. If there's any identification on that patient, the registrar, the front desk, would be able to pull up the EMR and aid the physician in making clinical decisions, because now they would have a history on that patient. EMRs can also expose potential safety problems when they occur. They also enable evidence-based decisions at point of care, based on a diagnosis, a patient's history, family history, surgical history, and medications they're taking. EMRs have decision-making ability, based on what's in the EMR at that point. EMRs can also provide built-in safeguards against treatments that would result in adverse events. Now I want to talk about improved care coordination. What are some of the issues? Well, some of the issues are medical care requires teams of healthcare providers, PCPs, primary care physicians, specialists, nurses, and technicians. Each team has specific expertise and view of the patient. This results in fragmented and sometimes disconnected facts and clusters of symptoms. So again, on the topic of improved care coordination, we just discussed what the issues were. Now some of the results due to having an EMR are we have improved information sharing. It's viewable and up-to-date medication and allergy lists. We also have order entry at point of care or off-site. Like I mentioned earlier, a physician can order a test or a lab from their living room or from the golf course. Now let's talk about some other benefits, the efficiencies and cost savings of using an EMR. As for the efficiencies, it's easy to access patient information from anywhere, from the hospital, from a doctor's office, from a vacation. Tracking electronic messages to staff, other clinicians, and hospitals. Everything's trackable now. There's an audit trail everywhere. Automated formulary checks by health plans. Order and receipt of lab tests and diagnostic images. As I said, you can order it. Interfaces run in the background, and they come back, and there's acknowledgement on both ends that this is occurring. You also have links to public health systems such as registries and communicable disease databases. Now we'll discuss some of the cost savings of using an EMR. One is reduced transcription costs. Often we use something called Dragon or some type of voice recognition software. No need to send out those transcriptions. Reduced chart pull, storage, and refiling costs. Improved and more accurate reimbursement coding with improved documentation for highly compensated codes. As I mentioned, we better return, better medical billing. Reduced medical errors through better access to patient data and error prevention alerts. Less medical errors helps cost savings. Improved patient health and quality of care through better disease management and patient education. Lastly, I want to talk about the EMR incentives, or what we call meaningful use. The American Recovery and Reinvestment Act of 2009, ARA, as it's known, authorizes the Centers for Medicare and Medicaid Services, CMS, to provide incentive payments to eligible providers, EPs, and hospitals who adopt, implement, upgrade, or demonstrate meaningful use of certified electronic health record (EHR) technology. CMS is making available up to $27 billion in EHR incentive payments, or as much as $44,000 through Medicare or $63,750 through Medicaid per eligible healthcare professional. Eligible hospitals, including critical access hospitals, CAHs, can qualify for incentive payments totaling some $2 million or more. I hope you enjoyed this module, Electronic Medical Record, and I hope you look forward to Module 2.